There's a quiet revolution going on in how people are taking control of their chronic, unresolved symptoms, many of which they've been suffering from for years. Their remarkable story begins with how their doctors and conventional medicine have missed the mark by prescribing costly and dangerous medications or performing needless procedures. They're still in pain, frustrated, and wondering why they continue to feel the way they do when they haven't heard any real answers about what's really wrong with their bodies, and without any long-term permanent solutions. But this story also has a remarkable ending for thousands who suffer from chronic symptoms who have finally found the answers and the relief in a very unique, home-based evaluation process. They've isolated the root cause of these unresolved symptoms in their biochemistries with this process that was originally developed by a team of bioengineers at NASA and is regarded by the medical and scientific communities as a genuine medical breakthrough.
There is a way, that there is a method, that there is a technique for identifying causes of unresolved or undiagnosed symptoms that is based in looking at things nobody else is looking at in ways that nobody else is looking at them.
My name is Dr. Richard DiCenso, and for over 30 years I've been helping patients all over the world reduce the impact and permanently eliminate chronic, unresolved, and undiagnosed symptoms of all kinds, including many of you who suffer from type 2 diabetes. And I've done so with a very unique, home-based evaluation and assessment process known as the Matrix Assessment Profile, or the MAP. Now, the MAP, originally developed by a team of NASA bioengineers, has changed the lives of thousands of people all over the world who have relied on costly and dangerous prescription medications, including daily insulin injections needed to normalize blood sugar levels. And if you're currently living with diabetes, you know the constant monitoring of your blood sugar that this disease requires. Now, in the story that follows below, you're going to learn about how the MAP's unique home-based evaluation process can help unravel the mystery of what's at the root cause of your diabetes.
You see, doctors don't always know what causes our symptoms to develop. Routine tests don't go far enough below the surface to isolate what's really wrong. So doctors rely on traditional approaches that include drugs and surgery, old methods based on an old model that just doesn't work. This leads to more tests, often thousands of dollars worth of tests, and still far too many of us hear the same conclusions. We can't find anything wrong, we have to run more tests, your symptoms are normal for your age, or it's all in your head. And we're all left with one big unanswered question: why can't doctors tell me what's wrong? Sound familiar? Perhaps you've suffered from an unresolved chronic symptom, tried everything, seen everyone, been everywhere, with still no relief. If so, you'll want to stick around because I'm about to tell you more about the evaluation and testing process called the Matrix Assessment Profile, or the MAP. It's been called a miraculous technique and is used by thousands around the world who suffer from chronic symptoms to answer those questions that their doctors and the conventional medical establishment couldn't. In fact, 90% of our patients who suffer from any number of chronic and unresolved symptoms report a dramatic improvement in the first 90 days of receiving their MAP results and implementing the recommendations. You see, our bodies are a lot like our cars. They're designed to run for a long time if we maintain them. And like the warning lights in our cars, our bodies have warning signals, and they come in the form of symptoms.
Symptoms are in and of themselves an attempt on the part of the body to communicate to you that something is wrong, that there's an imbalance or a deficiency somewhere that needs to be identified and serviced. And if these symptoms are ignored, or they're masked, or they're treated as symptoms, then all that's happening is they're being treated superficially. No attempt is being made to identify the underlying imbalance or deficiency, and eventually, left untreated at the level of cause, these symptoms will eventually progress into a diagnosable disease, which is the end result of the symptoms attempting to communicate that something's wrong.
Somewhere in your body, there's an imbalance that exists that's causing you to experience these symptoms. But your doctor doesn't look below the surface to identify the true source, the underlying cause of this imbalance. Instead, he or she treats the symptom itself with yet another prescription drug or needless procedure, which treats the symptom in the short run, but does nothing to identify and repair the thing that's actually causing the symptom.
Well, number one, they're not trained to look for them. Okay, they're trained in what's called a standard of care. So if someone comes in with a symptom, you diagnose that symptom. So in other words, basically your diagnosis is whatever you're telling the person that you're seeing. So if you come in with joint pain and they tell you you have arthritis, if you come in with loose stools and diarrhea and indigestion, you could get diagnosed with any one of the digestive problems: acid reflux, irritable bowel syndrome, Crohn's disease, which are all just names for the symptoms that you're experiencing. The patient comes in, describes their symptoms. They get a code for insurance purposes that's associated with that diagnosis. The physician gets paid and dispenses the medication that they were taught to dispense based upon the symptoms and the subsequent diagnosis. Conventional lab work and all conventional testing has a very high threshold, and that threshold is once whatever is causing your symptoms has progressed to the point where it's diagnosable with these conventional tools, and we can diagnose it as a disease and then offer you a solution for managing that disease, then and only then is the test going to be positive. But in the interim, you're going to go to the doctor with symptoms and be told things like, your symptoms are normal for your age. We can't find anything wrong. We have to run more tests. We have to wait and see, or the symptoms are all in your head.
This is what the MAP does. The simple biological evaluation process is done right from your home. It looks into your biochemistry and identifies the primary imbalance that's at the root cause of your symptoms. The MAP will tell you why you feel the way you do and why you continue to experience these symptoms. The MAP looks at things conventional medicine doesn't and looks at them in ways in which no one else is looking at them. At the heart of the MAP technology is the quantum fluid analyzer that looks at your body at a cellular level, peeling back the layers to see what's really going on inside. The MAP will identify imbalances and deficiencies that are at the root cause of your chronic unresolved symptom. And it does so with just small samples of your saliva and urine that get processed in our laboratory facility. Your MAP results come in a series of colorful charts and graphs that provide an evaluation of every system in your body to point to the biological source of why you feel the way you do. It will take all of the frustration and guesswork out of wondering what's really going on with your body. And the MAP will even do a calculation of your true biological age, the age your body thinks it is. Along with your results, this remarkable process will also produce a set of recommendations in the form of a 3-phase roadmap of exactly what to do, starting now, specific to your test results and without any of the dangerous drugs and costly doctor visits. Just imagine finally knowing why you feel the way you do and knowing exactly what to do about it. The MAP's 3-step ordering and evaluation process makes it the easiest, least costly, and most comprehensive health exam you'll ever experience. This is why the MAP is used by CEOs, professional and Olympic athletes, celebrities, and people from all walks of life to identify and permanently repair what their doctors and conventional medicine never could.
I've been on your system now for 2 months, 8 weeks. Lots of good things happening.
I am on the 28th day of my detox, feeling great, got a lot more energy, I'm thinking clearer, Waking up after like 6 hours of sleep, and I just feel like a totally different person.
So let me explain some of the specifics about what the map looks at for the typical type 2 diabetic. Now, we're looking at several aspects of normal biological function, such as digestion, elimination, energy production, free radical and antioxidant relationships, nutrient availability, as well as the overall function of over 18 major systems in your body that contribute or control the symptoms associated with diabetes. So a typical scenario is there's an underlying digestive compromise that allows you to not absorb the nutrients and the substances that are required for normal function of things like the pancreas, the parietal cells in the stomach, the mitochondria, which are energy-producing organisms inside the cell that are responsible for regulating your metabolism, responsible for producing energy to fuel all the functions in the body. So on a fundamental level, if you're not digesting, you're not absorbing the nutrients from the food. The nutrients are essential to the production of things like insulin. All of a sudden, the stress signals go off in the adrenal glands. The stress signals send a message to the brain that says there's a problem. All 50 trillion cells shut down, store enough food and oxygen for 3 seconds. And as a side effect, the presence of the stress hormones diverts blood from the digestive system, making it almost impossible for you to absorb the nutrients that produce the insulin, number one. Number two, it causes the carbohydrates in your diet to be stored as fat. And number three, it increases the production of cortisol, which then suppresses the immune system, further causing your body to not be able to absorb the sugars into the cell, but rather preferentially storing the fat as sugar for consumption at a later date. So this is a typical example of what we're going to see in a MAP profile associated with a type 2 diabetic. So you've got digestive compromise, inability to access nutrients, the proliferation of the adrenal stress hormones, and on top of that, you have the inability to metabolize sugar, so it gets stored as fat. Now, this is one of several scenarios that we often see with type 2 diabetics, and many times they have underlying causes that allow the body to create these imbalances and deficiencies, but nonetheless, when the profile comes back, when the fluids are read, when the evaluation is performed, it's extremely clear as to where the cause of the diabetes symptoms are rooted. So what the MAP will do is look into your biochemistry and locate exactly what's going on at the origin, the root cause, and not what conventional medicine does by looking at a set of conditions and assigning it a name like diabetes, and then prescribing a standard of care protocol that assumes everyone's diabetes is the same. We've put thousands of patients through the MAP process, and the emails and letters we get from people who are experiencing health and life and vitality in a whole new way is truly remarkable. So let me tell you about the evaluation process. First, we send you a confidential home-based testing kit with specific instructions on what to do. We'll send biological sample containers and instructions on how to ship your kit back. There's also a confidential questionnaire about your symptoms and your health history, and we use this information to map out a series of individualized protocols to start working towards reducing these symptoms. We'll also provide educational material about the entire testing process. And by the way, we only need a saliva and urine sample, as the specialized nature of our new software predicts within 1% accuracy the blood results. The report of your results, which is incredibly thorough, come in colorful charts and graphs and analyze the health of every major system and organ in your body and specifically point to what the primary contributor is to why you feel the way you do and your symptoms. The report will show you where the imbalance exists in your biochemistry that are contributing to accelerated biological aging, your true age, the age your body thinks it is. Also, the report will even calculate your biological age. The report even has a terrorist alert system that points to the obstacles in your biology and will show you the warning signs of disease beforehand so you can focus on prevention. It is by far the most comprehensive look at your biochemistry that you've ever experienced in just one simple home-based test. Then, as part of the MAPS evaluation process, we'll also send you a summary of all of these reports and a series of recommendations, a roadmap as to what you need to start doing right away and over the next 12 weeks or so, including any supplements, lifestyle changes, diet changes, exercise, etc. And we'll even guide you through the process, meaning we'll work right along with you. Many clients also decide to opt in for a private consultation with me to discuss the results and their roadmap. So we make that available as well to order separately. And we also have a weekly Ask Dr. D call where clients can jump on a call, ask me a question about their results and their roadmap. It's a pretty comprehensive experience. My team and me are really focused on creating an experience for our clients that far exceeds the way they've been treated by any primary care physician. The MAP is for people who have been suffering from any number of chronic or acute unsolvable symptoms from chronic pain, inflammation, arthritis, diabetes, acid reflux, high blood pressure, headaches, achy joints, low energy, sleep disorders, fatigue, weight gain, cholesterol, anxiety, depression, even things like Parkinson's and cancer, who want to get to the root cause of their symptoms and why they feel the way they do. Our best clients have typically been worked over by the traditional healthcare system and are frustrated that after the traditional route of drugs and various tests and various procedures, they still have no answers. But equally important is the people who the MAP is not for. Because of the highly interactive nature of the MAP process, we ask our clients to be engaged with me and my team, that you communicate with us along the way and tell us what's working, what's not working, and that you take a very active and responsible role in getting yourself better and feeling great again. We have no problem reimbursing someone for their investment who doesn't fit this criteria, as there are just too many people we want to serve who do take on that level of responsibility. Now, I've already shared with you the three-step testing process, so now let me tell you what you'll receive when you take the next step and make the investment in the Matrix Assessment Profile experience. When you order your MAP today, you'll receive a home testing kit with easy-to-follow instructions, biological sample containers, and remember, no blood is required, a confidential history questionnaire, so we have some history on your symptoms, detailed instructions and safe biohazard packaging for shipping your samples back to our lab. And after our team processes your fluids, we're going to send back to you your MAP results in a full report with colorful charts and graphs that show exactly where the imbalances exist that are at the root cause of your chronic symptoms. You'll get an evaluation of every gland, organ, and tissue that makes up your biology, including MAP's Terror Alert System, which reveals the warning signs of disease before it happens. You'll get a calculation of your true biological age, which is a measure of the rate at which the cells in your body are aging. You'll get easy to understand instructions on how to interpret your results. We'll even send you a summary document of all your results and what they mean. You're also going to get a personalized roadmap on what to do with all of this information. In the roadmap, I'll make recommendations specific to you on what you should be doing over the next several months to fix the imbalances and reduce and ultimately eliminate your symptoms, including a suggested detoxification program to clean up and detoxify your biochemistry. The roadmap will give you specific recommendations for a support program to strengthen the system that is contributing to your symptoms. The MAPS roadmap will even tell you how to maintain the balance in your system as you start to feel better and return your body to a healthy state. You'll know exactly what supplements you should be taking, what lifestyle changes you should adopt, a suggested diet, and even how to reduce your true biological age. You'll get access to our regular live Ask Dr. D call, where you can jump on a call with me and ask questions about your MAP and your MAP results, or about the roadmap we've laid out for you. Or you're even going to get my 30-day money-back guarantee if you're not happy with any part of the MAP experience. Bottom line is that if our clients aren't happy, they should get their money back, and we're very serious about that. And I'll also tell you that if you were going to go and have the type of comprehensive laboratory work done that the MAP will provide in one simple test, you're looking at several $100s, perhaps $1,000 just in diagnostic testing alone. And if you were to add the cost of all of the various tests for specific tendencies that the MAP evaluation does, you're adding another several $1,000s to that. And this doesn't even include the cost of any treatment program to fix the imbalances. We know what these things cost. We've done the research. The MAP is going to give you one of the most comprehensive understandings of your inner health you have ever experienced, and tell you why you feel the way you do at a fraction of the cost of what traditional lab work will cost. So, if you order the MAP today, we'll send you the home testing kit and the entire sequence of reports showing the root cause of your chronic symptoms, and the 3-phase, 12-week roadmap, and personalized recommendations, all for only 2 payments of $97. All you need to do is click the Add to Cart button below, and we'll get your MAP evaluation kit right out to you. I also want to let you know that we typically have a large demand for MAP kits, and our facility only has the capacity to process a certain amount of MAP evaluations at any given time. So even if you're just sitting on the fence and are unsure, I strongly urge you to take advantage of this offer and the money-back guarantee right now by clicking the Add to Cart button right here.